doctor shortages for us here in Deep South Texas, we are one of those areas in the nation that has perpetually been classified as an underserved area. I'm wondering what you see on the horizon as a result of, new law, Obamacare, and other things that are happening. What do you think will happen as far as doctor shortages? Do you think, the problem can be solved on the horizon, or do you suspect that things might get much worse as maybe some physicians decide to leave the industry as a result of all the new regulation?
Well, all of that is happening, and I'm an optimist by nature, so I'm going to say that when the public wakes up, when the public takes their eyes off the reality television screen and look at the own reality that is going to look like, even if they have the money, they have to wait in line to see a physician. And a lot of them are not going to be able to see a physician because the prices are going to go up. They're going to ask something to be changed, and I think then things will change. However, let's look at the present, what we have in front of us, and project that into the near future. I'm talking about the next 5 to 7 years, not decades down the line. We're looking at over 91,000 physicians short of what we need. Now, keep in mind that, especially you, as you said, you're in an underserved area. You fall into the category of 20% of the population lives in rural areas. That's about 50 million people, roughly. And only 9% of physicians are available to that 20% of population. So, and that's going to get worse because with the reimbursement rates from Medicare, Medicaid going down by roughly 30% across the board, then you have this, I don't know who came up with this amazing idea that, hey, let's give more money for the same exact procedure to a physician that's working for a hospital and less for the same exact thing, for the same exact service to a physician that has private practice from the same exact program that is funded by tax dollars, Medicare. That makes no sense to me. So when you look at all these forces combined, and then you throw on top of that the burden of the bureaucratic paperwork that physicians have to deal with, you see an exodus of physicians from private practice. They're going to work for, some are taking early retirement, some are going to work for a hospital. Now, I do want to say one thing. I think a lot of the physicians are jumping the gun, they're panicking, because complexity, for example, our clients, they don't have to deal with complexity for multiple reasons. We take away that drudgery. We do that work for them. Also, there's technology available out there. So I saw a story where this physician was talking in, actually another part in West Texas. And in the video, in this news story, she had this stack of paperwork that she was saying she had to deal with. And I'm thinking, well, come sign up with us because we take away all that paperwork. We give you an iPad where you are using the latest technology. So I think there's a lot, what I'm trying to get at is that it is a big problem. You have 29 million newly insured people coming online. You have physicians that are retiring due to a natural aging process. And then we have cut back the funding to, even though if you can go to medical school, and medical school are taking more, they've increased their enrollment rates by over 16%. The problem is you still have to get through residency. And residency takes money. You have to have money available for people to complete their residency. And unless they can do that, they're not going to be able to go out there and provide healthcare. So
and we've never addressed this as a nation before, Zahid. I'm wondering if perhaps the argument that we should be increasing the enrollment numbers at medical school, maybe perhaps doubling the numbers and not capping them off to limiting them to only 150 students coming in every single year for that and nursing. Perhaps if that could be lifted, because that leaves a lot of students wanting to get into the medical profession that are simply left out because they don't make the cut, and yet they're still good students. They have good grades. They may have the grades, but they don't make the final cuts of those enrollment classes. Should we be addressing this issue from that vantage point and rolling out more doctors from our medical schools, and maybe even consider relaxing the import of medical professionals, for example, just south of the river in Mexico, who are just as qualified to come and practice medicine in the U.S.?
Well, you're absolutely right. I think some of those things are already starting to be done. Some of those are being considered. But at the end of the day, you have to look at the business side of this too. Now, I do want us to clarify that. I have never met a physician, with the exception of perhaps plastic surgeons that are different breeds. Almost all physicians that I know and have met and I know of, they are passionate about taking care of sick people. They're not motivated by money as a primary reason. That's not why they become physicians. But if you look at the economics of this industry, we are making decisions at a bureaucratic level, people that don't know much about the industry from an insider point of view, and I'm not sure who's advising them to make these decisions. We're getting an environment where it is impossible to have the supply side survive. And what I mean by that is that when you look at the supply side, it is not just the physicians, it's the insurance companies. The insurance companies, as much as people dislike them, they're an essential part of the solution. They exist in a free market system. You don't have a business, a large business exists because nobody wants it. It serves, it adds value, therefore it exists. And we're trying to create an environment where we are saying you cannot control the risk, but we're going to limit the reward to you. Now, in a free market system with those two conditions, capital is going to flee. It's going to go somewhere else.
Joining us on 710 KURV, Chief Financial Officer for Great Lakes Medical Billing, is Zahid Khalid.
Zahid, Tim Sullivan here. Good morning.
Good morning, Tim. How are you?
Doing well. Does Obamacare, the new health care law for the country, does it provide any incentives at all for doctors to practice in rural areas? Things like I know that the Texas legislature has tried to do, for instance, to bring more doctors to serve patients in West Texas and similar rural areas. Any incentives, financial or otherwise, for to beef up physicians in the country's rural areas?
Well, there are some incentives, and actually, the question is not whether there are incentives, because the answer is there are. The question really is, are those incentives enough? And the answer to that is no. And otherwise, this problem, we wouldn't be talking about it.
Well, what are those incentives within the law, within the new healthcare law?
There's really not in the healthcare law that I'm aware of. And again, it is such a complex and lengthy document that I don't think, at least I have not gone through the entire thing word by word. So I don't see any incentives that are going to make physicians go and practice in the rural areas. What has been happening over the long term and previously has been that there's some provision for loans, the debt they carry for going through the medical school. Some of that is forgiveness. But those are not enough to solve this problem.
What more needs to be done, do you think?
I think they really have to look at a few things. One is that let's enable these people and give them the incentive to leverage technology so that because what is the reason why people don't go into the area? The reason primarily is your standard of living is you're not taking advantage, even if you make all the money in the world, you don't have access to some of the things. For example, are you going to have, these physicians are sophisticated, educated people, perhaps they would like to go relax and listen to the opera. Well, we have an opera house nearby. I mean, these are things, some of these problems cannot be solved.
Zahid Khalid, Chief Financial Officer of Great Lakes Medical Billing.